Hello everyone, and thank you for joining me, Nicola Doyle of UK Therapy Guild. So I want to talk to you today about something that comes up in my work time and time again, that being the use of antidepressants. They're often surrounded by myths, strong opinions and misunderstandings. My aim here isn't to tell you whether you should or you shouldn't take them, but to share a balanced, science-backed perspective so you can understand what they do, when they might help, and the things to consider if you're thinking about taking them. So we will begin by looking at the cycle of stress and fear and how this affects us in our daily life. When we live with ongoing stress, it's like our body and our brain keep one finger on the fire alarm, ready to pull it at the slightest hint of danger. Biologically, this is linked to our neurotransmitters, which is the brain's chemical messengers, like serotonin and dopamine. When stress becomes chronic, the brain's finely tuned chemical balance can start to shift. It's a bit like having a thermostat stuck too high or too low. Your mood, sleep, appetite, and ability to concentrate can all be thrown off. This is where a vicious loop can start. You start to feel anxious, so you avoid certain situations. By avoiding them, this gives us temporary relief, but it also starts to shrink your world. That isolation feeds sadness or anxiety further, and you end up feeling more stuck than before. Over time, this can move from being a passing rough patch into something that feels more like a heavy fog that you just can't seem to get out of. So we're going to have a look at how antidepressants may help. Antidepressants work by influencing the levels and activity of the neurotransmitters. The most commonly prescribed types include SSRIs like sertraline or fluoxetine, SNRIs like venlafaxine or duloxetine, tricyclics and others, often used if the first-line medications aren't effective. By restoring more balanced chemical signalling, the antidepressants can help turn down the volume on those constant mental alarm bells. They don't instantly make your life better. They aren't happiness in a capsule, but they can reduce the intensity of the symptoms enough to help someone to re-engage with therapy, self-care and daily life. A 2018 meta-analysis in The Lancet involving over 116,000 participants found that every antidepressant studied was more effective than a placebo for adults with major depression, although the degree of benefit varied by the drug. This is why finding the right one for you is often a process. We'll look at the pros, cons and effectiveness of antidepressants next. For moderate to severe depression, large-scale studies consistently show that antidepressants are significantly more effective than a placebo, with around 60% of people experiencing noticeable improvements within 6 to 8 weeks, compared to roughly 40% with a placebo. For mild depression, the benefit over the placebo is smaller. Here, talking therapies like CBT or interpersonal therapy often perform just as well and sometimes better without the potential side effects. Therapy effectiveness is also well documented. A major review of the American Psychological Association found that psychotherapy produces benefits equal to or greater than antidepressants for many people, especially over the long term. Therapy also equips people with coping strategies that last well beyond the treatment period. So with that in mind, let's explore a combination of using antidepressants alongside therapy, as it tends to have the highest success rates documented by the National Institute of Mental Health trials, which found that people receiving both antidepressants and therapy were nearly twice as likely to recover compared to those receiving only one approach. And this is why so many professionals view antidepressants as a stepping stone. They create the mental space to benefit from therapy and lifestyle changes. The advantages of taking antidepressants may be that they can create stability, as for some, they're a lifeline, giving enough stability to manage work, relationships, or simply to get out of bed. Freeing oneself from the constant panic and mental alarm bells allows individuals to have the space for therapy, as when these symptoms are reduced, people are often more able to engage in the deeper therapeutic work. Antidepressants are not just used for depression, but also for anxiety disorders, OCD, PTSD, and even certain chronic pain conditions. The potential drawbacks of taking antidepressants are the side effects. These can include sleep changes, digestive issues, headaches, sexual side effects, and sometimes weight gain. Many side effects do improve after the first few weeks, but not always. So there can be a period of trial and error, as the first medication or dose may not be the one that works, and this process can be frustrating. A very important note here would be a small risk within the first few weeks of taking medication that you may incur suicidal thoughts. This can happen especially in the under 25s, which is why close follow-up through your GP is essential. So, what are the alternatives to antidepressants? Antidepressants are not the only way forward, and for some, they're not needed at all. Some well-researched approaches include cognitive behaviour therapy, CBT, which is used to restructure unhelpful thinking patterns. Interpersonal therapy, which is used to improve relationships and resolving interpersonal stress. Lifestyle interventions, such as regular exercise, perhaps a Mediterranean-style diet, improving your sleep hygiene, mindfulness and meditation have all been shown to have measurable effects on brain chemistry and mood regulation, as has been in nature and connection. Studies show reductions in anxiety and improved well-being after just 90 minutes of walking in green spaces. Often, the best results come from using both antidepressants to create breathing space while also engaging in therapy, social connection and healthy routines. If medication has been part of your recovery, there may come a point where you and your doctor decide to stop, and this should never be done suddenly. Stopping abruptly can cause antidepressant discontinuation syndrome, with symptoms like dizziness, brain zaps, irritability, and flu-like feelings. Instead, doctors recommend a slow taper, often over weeks or months, tailored to the individual, the drug and how long you've been taking it. And just as important, even after stopping, having support in place is crucial. Support such as therapy, community, healthy habits all help to maintain mental stability. My final thoughts are that antidepressants are neither magic bullets nor villains. They're one possible tool in a much bigger toolkit for mental well-being. For some, they provide just enough lift to start the deeper work of healing. For others, they may not be the right fit at all. Whatever your path, never start or stop medication without medical guidance. You deserve a plan that's safe, personal and grounded in evidence. Thank you for listening. If you're interested in a career in counselling, why not take a look at our website www.uktherapyguild.co.uk.